Good afternoon, and thank you for joining us on H360 Live. My name is Dave Duplay, and I'm joined here this afternoon with Courtland Long from Healthy0360. I'm also joined in the studio today with Joe Tavano. He is a young man from New York living with diabetes and also a double amputee. We have a very exciting show for you today, so let's jump right in and let's talk about what's trending on Healthy0360 this week. We're going to start with an interesting study, and I find it interesting because I have two teenagers that are driving. But the story is that too many teens are still texting while driving, and the state laws have helped reduce a lot of that, but still many of the teens are texting and driving, and a study has been done about that. So, Courtland, what do we know about that study?
Well, we know that texting and driving boosts the risk of a crash by about 20-fold. Dr. Andrew Aidsman, who was the lead researcher on this study, says that tragically, smartphones still allow teens to do stupid things while driving a car. And there are many states, as you mentioned, that have outlawed texting and driving, and between 2011 and 2013, about 14 states have created laws that don't allow people to text and drive. I believe there are a few more that have been added to that list lately. And between 2011 and 2013, the rate of texting and driving has fallen from 43% in 2011 to 30% in 2013. So the laws are having some effect, but it's still not quite where we'd like to be.
Yeah, and it's really not teens. I do a lot of driving, and I can really tell I'm driving down the New Jersey Turnpike or Garden State Parkway, and I see a car ahead of me kind of weaving back and forth. Immediately it jumps to, texting. Yeah. 10 years ago it would have been, they're coming from the local pub. Now it's texting. And so I have read a couple of interesting things about texting and driving, and this I think goes to reaction time. But let's say you're driving 55 miles an hour, right? Now, of course, we all know nobody on the highway drives 55 miles an hour, at least in the Northeast. And a driver is texting. The reaction time from looking down and texting to picking up your eyes, driving 55 miles an hour, the reaction stop time is about the length of a football field.
I've heard that. Yeah.
Isn't that crazy? And so could you imagine now a young driver that doesn't have the reaction time down and they're new behind the wheel is going to cause some significant issues there.
Yeah, and this is especially important for young teens and young drivers because they have less experience behind the wheel, and so they're not going to react quite as well. But this study also says that texting and driving is actually more dangerous than driving while under the influence. So
yeah, well, we don't condone either, just to be clear about that, right? At Healthy0360, we're about healthy living, and so we don't condone any of that nonsense. And the cell phone carriers are really pushing hard to put the cell phone down and, keep your eyes on the road. And the reality is a text message or an email, it can wait, right?
While the cell phone carriers are pushing, campaigns for putting your cell phone down while driving, unfortunately, to date, I don't think they have anything, for parental controls so that you can shut the phone off while your teen is driving or anything like that. However, there are many apps that are available for smartphones that you can set it to say to respond to a text or a phone call immediately so that you don't have to, and it will say something like, I'm driving right now and I will respond to your text when I get off the road.
Yeah, yeah, that's a smart thing to have on your phone, right?
It's a tremendous epidemic. I mean, and the thing is, I take a lot of car services, and these guys are always on their phones, like professional. And I make them put it down. I say, put that down. I don't want to be in your car while you have, while you're talking to your girlfriend or whatever you're doing.
Yeah, good for you, watching out for your
safety.
Make
them put the phone down.
Yeah, no, that's incredible. But we're in a society now where I think, especially the younger generation is I receive a text or I receive an email and they're expecting, a text back within 15 to 20 seconds, right? So we've created this environment where
there's a certain time that you need to respond.
It's texting etiquette, right? It's texting etiquette. Yeah. And I think the app is a good idea because if I text you and I automatically get a reply back that says, hey, I'm driving and I will return your text or your email when I'm able, at least it lets the recipient know what the story is, right? So, and again, it's not just the younger generation. Everybody is doing it. And so, you know, the message is clear. If you're driving, put the cell phone down, because it's going to save lives, and the life it could save could possibly be yours. So focus on the road and less on the text, and we're all going to be better off for it. Cortland, I think we have a health tip, right? We're all about health tips, Joe. Every week we try to ingrain input a couple of health tips into the discussion. And this health tip number 1, is 6 springtime health tips to help us roll into the summer season, right? And our weather here in the Northeast has been kind of up and down. We get some warm days, and so I'm not really ready to declare we're rolling into the summer, but it's coming soon, and we've got a couple of health tips for you. Cortland, what are some of the health tips that we ought to be thinking about here?
Yeah, so the first health tip is to renew your resolutions. One of my good friends likes to say, bikini season is right around the corner, and you know, it kind of always is, whether you go on vacation in the winter or...
I quit saying that, by the way, right?
Good.
Okay.
Yeah.
So the bikini's in the closet?
It is in the closet, yep.
So, you know, renewing your resolutions, when the New Year's hits, people like to make or break habits, but according to the Gregorian calendar, our New Year happens in the middle of winter. And during that time, so many people, animals are hibernating, and who really wants to be, you know, trudging to the gym at 5 in the morning in the dead of winter? Nobody. So the spring is a great time to renew that, because there's a lot of new energy happening in the spring, and it's just a really powerful season.
But even our resolutions on self-improvement, right? I find in the wintertime I'm more apt to dedicate myself to reading a book that I've wanted to read, or I'll pick up my guitar and try to learn the guitar for about the 15th time. And so then spring rolls around, I've gotten 2 or 3 chords under my belt, and then we're off to doing other things as the nice weather breaks. But you're right. I mean, it is time to renew our New Year's resolutions and focus on the summer months.
Yeah, and along those lines, the second tip is to invigorate your exercise routine. So a lot of people around this time will start feeling a little restless. You know, the sun is coming out a little bit longer. So a great way to invigorate your exercise routine is to go out for a walk. If you've had lunch and you have a little extra time in your break, go take a walk around the block, or ride your bicycle up and down hills rather than sticking to flat terrain. And you know, try a yoga class or something that you're a little less familiar with.
Or even just getting out in the sun, right? During the summertime. The weather is nice now, and at least in this area, you know, there's several small parks, and you can have your lunch in the park, and you can get some sun, and I think that's good for your health as well.
Yeah, and that's actually my tip number 3 is wake up earlier and play outside. So, you know, the sun, as we were just saying, is up earlier and out longer. So it's a great way to try to wake up with the sun and see how, you know, that will give you a little bit more vitamin D and, you know, make your mood a little bit better.
Joe, are you a morning person?
I was just about to say, I'm not a morning person.
No?
No. Well, I have to be sometimes because work calls or something, but besides that, I'm usually coming in at that time.
Okay, so we're going to revise the list of health tips. We'll come up with one.
You got to have the Joe Tavano list of things.
Yeah.
Exactly.
Yeah, so tip number 4 is to lighten up your food. Springtime is the time of expanding energy, and so we're trying to move away from the heavier, slow-cooked foods to lighter, stir-fried, quicker cooking foods, and to try foods that are popping up above the soil, like beans, spring onions, and asparagus are really good.
Yeah, I'm a big one on that. I love summer tomatoes, right? And the sweet corn in this area, the Jersey corn as it's known, that comes in from the farmers markets, it's just phenomenal. And so I'm all about lightening it up in the summertime, and tomatoes are some of my favorites.
All right. Well, speaking of flavors, the second to last tip is the flavors of springtime. So, you know, you want to try to invigorate your liver, which is the organ associated with spring, with some sour flavors. So incorporate vinegar or lemons into your food. And you can spice up your meals using mint, spring onions, ginger, horseradish, mustard, and peppers, and those will leave you feeling cleansed and invigorated.
Now, why is the liver the organ of springtime?
I don't know.
You don't know?
No.
Okay. Probably because we're invigorating our liver and ingesting some things of flavor.
Yeah,
right?
Maybe it helps to cleanse. You know, spring is a cleansing time, so...
Yeah. That's why I guess they say spring cleaning, right? So it's not only appropriate for your apartment, but it's appropriate for your body, for your liver. Yeah, absolutely.
Exactly.
Do we have one more?
We do have one more. So the final tip is to stay bundled. So I know a lot of people are very excited about springtime. You know, you can shed your coats, your down parkas, but you should really still try to wear a light jacket and a scarf. The winds are blowing a little bit heavier now, so it's still important to stay a little bit bundled up.
Yeah, very good. Well, thanks for that health tip. That's very informative.
Of course.
That's great.
Yeah. I think we have another health tip. We're rolling in from one end to the other, right?
Yes. Mm-hmm.
And this second one, I kind of have named it, a penny saved is a penny earned. And what I'd like to talk about is our Healthy O360 prescription drug benefit card. You know, it's amazing. And Joe, being a person that's living with diabetes, I would imagine that you're on several medications, but the medication drop-off rate in this country, or non-compliance as it's known, is really significant. I think it has a lot to do with a lot of issues, but one certainly is the price of prescription drugs, right? Mm-hmm. We all know that, and some of them that we're on can be very pricey. Well, at Healthy O360, we have a prescription drug benefit card. I want to make it clear this is not insurance. It's supplemental to insurance. But what the card does is it will allow you up to 85% off of your prescription drug when you go to the retail pharmacy. And so we have a card that is on healthyo360.com. It's very easy. It's free, by the way, so you know, it's handy. And you can get it a couple of different ways. You can go to healthyo360.com and you can print it off. You'll find the card in our perk section, and you can go to the prescription drug perk and you can print the card right there. If you have a smartphone, you can enter in your cell phone number and we will text you the card. And that makes it easy because you don't have to worry about printing or carrying the card to your pharmacy. You just simply take your smartphone and you show it to the pharmacist, and it has all the appropriate numbers that will apply for your discount there. Or if you so choose, we can email you the card, and then you can print that at home as well. So, or again, if you have a smartphone, you could show it to the pharmacist by email. But again, it could save you up to 85% on your prescription drugs. Of course, not all drugs qualify, but most branded and generic drugs do qualify, and this card is accepted at over 99% of the retail pharmacies across the country. Mm-hmm. It's good at most of the big ones like Walmart and Target and Duane Reade and Rite Aid. And then it's also good at some of your little independent local pharmacies. So we also have a free access customer service that you can call 24/7 to find out before you head to the pharmacy if the prescription that you're on does qualify for a discount under this plan. So again, you can find that prescription drug benefit card at healthyo360.com in our perk section, and I hope everybody takes advantage of it because it's free. Mm-hmm. Yeah.
That's great.
Yeah.
And we know some people who've used the card and gotten some pretty nice discounts from it.
We do, myself being one.
Prescriptions are unbelievable. When I was going through the whole process of the amputations and stuff, and I pay $8,000 or $9,000 a year for insurance, you're always making co-payments on these on your drugs.
Right.
And I was up to $350, $400 a month between the antibiotics and the insulin and all the other stuff, and even a little something like that, I'm sure could have helped out tremendously especially when you're not working.
Yeah. Yeah. No.
Or you're on limited income.
Yeah, it really does help, and we know several people that have really benefited from the use of the card. Like I said, myself included. I'm on a triglyceride-lowering medication, and I take advantage of the savings every month when I renew my prescription. So, again, I would encourage everybody. It's free, so go out and download the card, or we'll be happy to text it to you and take advantage of the savings. Mm-hmm. So we're going to move into an interesting article that's really been in the news. I think we've all probably heard about it, right? And it's the Bluebell creameries have had a significant recall, right? So Texas-based Bluebell creameries recalled its products after they found listeria in their products. And so a massive recall. Mm-hmm. It's been in the news. But I've got to hand it to the company. You know, they stepped up to the plate. They've recalled all their products. They've gotten it off the market, and they've really taken a very proactive approach to solving this problem. But I do have some questions. Cortland, what is a little more that we know about the recall, and specifically this thing called listeria? What exactly is that? Do we know?
Yes, we do know. So listeria is a bacteria, and it's quite hardy. It's found in soils and water. Once it's tracked into a facility, a processing facility such as Bluebell, it can be quite difficult to get rid of because it grows well in refrigeration. So that makes it a little bit difficult or different from other bacterial strains. It's commonly found in processed meats, unpasteurized cheeses, unpasteurized milks, and other products like that.
And so what exactly has been recalled? Was it their entire product line?
Yes, Bluebell recalled all of their products. They really, as you said, stepped up to the plate. You know, they wanted to nip this recall, this listeria outbreak in the bud, so they recalled everything. 2 samples of their chocolate chip cookie dough ice cream had tested positive for listeria, and they just pulled everything back.
Wow, that's amazing. How does it get linked to ice cream, though?
So this was linked basically from a random sampling. It was the South Carolina Department of Health and Environmental Control were going about, you know, their jobs, and they did a random sampling of Bluebell products back in January. And that was when the first instance of listeria was found. And so they notified the FDA, and I believe the FDA then notified Bluebell, and they took action.
Wow. So what are some of the symptoms? How do I know if whether it's ice cream or whatever it happens to be, how do I know that I have listeria? What are some of the symptoms that I would experience?
Well, some of the symptoms are fever, muscle aches, gastrointestinal symptoms, which we don't need to get into, and even death. So it can be a serious issue. However, people, you know, like you and me who are in the prime of our lives and rather healthy will not be majorly affected by listeria. It's mostly people who are, you know, the vulnerable populations classified as the very young, the very old. So elderly, newborn babies. Also included within that are people with compromised immune systems as well as pregnant women.
It's amazing. And how did this happen? Was it the water? Was it?
So they're still investigating the outbreak. They do not have a cause just yet. However, it could have been due to unsanitary conditions or dirty equipment. But Bluebell, you know, again, they are really stepping up to the plate. They have expanded their swabbing system by about 800%. So they are really taking charge of this outbreak.
Yeah, so Bluebell, I'm not sure if anybody from their organization happens to be watching or would see this, but thank you for stepping up to the plate and doing the right thing and recalling all the products. And I think at the end of the day, it's going to go a long way for them. So unfortunate circumstance, but very informative, and now we know what to look out for.
Yeah.
Right? So Joe, thanks for coming into the studio today.
My pleasure.
You're a New Yorker living with diabetes.
I am.
And you're also an author, right?
Yes, I am.
Of a children's book?
Well, I do many things, but yes, author is one of my hats.
Okay, and the book is?
It's called A Dachshund's Wish.
A Dachshund's Wish.
Which is right there. It was based on my dachshund paw, so I had about 15 years. He passed away not too long ago, actually. And he inspired me to write this book. And it's a children's book, and it did very well. And it came out in 2006. And we're in the process right now of releasing the sequel to the book, so that's kind of exciting.
So how do you go about deciding you want to write a book? I'm interested. I want to write a book, but I don't know where to start. I don't know what to do. And
well, in my case, it was something that I have a whole other career. I'm in television, so author was, and I'm a good writer, but I never really thought about actually writing a book. And what happened was that I was at my sister-in-law's house, and they asked me to go upstairs and tell the kids a story, put them to bed and tell them a story. And I did that, and they were downstairs, and they realized they sent Uncle Joe upstairs to tell them a story. And they didn't, you know. So they come upstairs, and they're standing outside the door, and they were listening to this, and, you know, me sort of wrapping up the story and telling and putting the kids to bed. And I come out in the hallway, and they're all in tears. And I'm like, what's going on? And they're like, that was a beautiful, beautiful story. And it was, of course, a much scaled-down story to what the actual book is. But they also work in publishing, my sister-in-law and my ex-wife. And they said, you've got to put that to paper. And I said, okay, when I get time. And what happened, the interesting thing was, I didn't have time, and I kept sort of, I don't have time right now, I can't do it. But when I wound up in the hospital because of the first amputation, they didn't come to see me. They came with a pencil and a paper, and they said, start writing. And that's how I started writing the book. And a year later, the book was published.
And you had a little time on your hands then, right?
I did. I mean, it's not just the time you spend in the hospital. It's the time that you're home rehabilitating, and the time that, you know, just you do have lots of time on your hand when you go through amputation. So I'll share that with you.
So you are a double amputee.
Yes.
And not both taken at the same time.
No.
Let's kind of step back a little bit and talk about your diabetes. How long have you been living with diabetes?
When I was 30, I'm 55 now. When I was 30, I was diagnosed with it. And it was interesting because I owned a house at the time, and I was in my backyard doing some stuff, and I just started feeling worse and worse and worse. And I called my wife and said, we're going to the hospital now. And I get to the hospital, and not only do they diagnose me with diabetes, but I was DKA, which is a really, really serious form of diabetes at that point. So they put me on treatments and whatever, and things were fine. And then I sort of fell off the wagon a bit. You know, you always know better. You think you know better. I'm getting ahead of myself.
So you go in, you're diagnosed
yes.
with a very significant, not just normal
DK is life-threatening at that point. That's okay. Like when you're like really off the scale, as far as, you know, blood sugars and things like that.
And before that day, when you said to your wife, that's it, we're going to the hospital, did you feel any of the early warning signs?
Occasionally, like you're tired, you know, but I never felt bad. And that's the thing about diabetes.
Blurry vision?
Well, I've always had blurry vision since I was 6 years old. It didn't mean anything to me.
No weight loss?
No, actually, I was always a kind of a, you know, bigger person. So at the time, I was actually up in weight. I'm down to now about 225. I was up to about 290 something at the time. So it wasn't a thing of weight loss. It was more of like just being big. And so anyway, before that, there were no signs, really. As my mother had diabetes, and you always have that instinctual thing in you saying one day you just feel you're going to have it. You know, there's always something instinctual inside you, and that's why people go to like all these expos and things like that. Because even though they don't have diabetes, they want to get checked out because it runs in their family and things like that.
Right.
So.
Is it something you were talking with your physician about when you'd go for your annual exam?
What's an annual exam?
Oh, Joe.
Yeah, I was very, very bad. I was very lax about my health care, you know, and it's a real problem for me. I'm a very busy person, and it's a wonderful excuse for not taking care of yourself. It is, you know, you just, I got to go here, I got to go there, I got to do this. But yeah, at the time I was taking pretty poor care of myself, and when I went to the hospital, it was a real eye opener.
And so you get diagnosed, and does your physician at that point in time put you on diet and exercise, or what was the first original treatment plan that was prescribed?
Immediately with insulin. There was no pills. There was not a type 2 thing. It was a type 1 thing. From what I understand, and I don't understand all the technicalities of it, but I'm insulin resistant, where the cells in my body's producing insulin, but the cells in my body don't take the insulin in. So they sort of fix that by, you know, giving you by taking insulin and stuff. So yeah, it's a different type of diabetes, and it's a little more harder to control. And it's pills and things like that don't work on me. Like I come with a different set of instructions, you know, just things like they always have to find new ways of doing things with me because my body just does not cooperate.
And then you said you fell off the wagon. What does that mean? So you get your instructions. You're on insulin.
I was doing great for like 2 years.
Yeah,
I was doing great, and then you get a little cocky, and it's like, I feel good, my blood sugars are great. As a matter of fact, at that point, they had taken me off insulin because I had dropped weight, and my body was sort of reverting back to the way it was. I was actually doing very well. And then you just say, I don't need to do this anymore. And that's exactly what I did. and wound up back in the hospital. You know, it took years. It takes years to come back and then to sort of make itself known again. But again, it's a continuing cycle. And one thing I always tell people, and I did not follow my own advice, is Einstein once said, being stupid, the definition of stupidity is doing the same thing over and over again and expecting different results.
Right.
And I did not follow that wonderful advice.
Yeah. Now, I have a lot of friends who are certified diabetes educators, or CDEs, and they're really, in my mind, it's the nurses and the certified diabetes educators are really true unsung heroes in our healthcare system. They really make things happen. Were you working with a certified diabetes educator when you were first diagnosed?
I was. I don't remember the person's name because you only see them three times a year or something like that. So I can't remember her name. But right now I'm currently working with Ann Levine at Montefiore Hospital, who is wonderful. But yeah, at the time, I was working with people, and they make a lot of effort to keep you on the straight and narrow. But it's up to you to sort of do it. Mm-hmm. You know.
You can lead a horse to water, but you can't make it drink.
Yeah,
that's a perfect saying, right?
Thank you.
Yeah. So we have a video for our audience, and just to tee it up, Joe, it's a video of you having a discussion with your physician about amputation.
This was the second amputation.
Okay, second amputation. And then we, on the tail end of that, we have you going through putting your legs on, right? After
yes.
both legs have been amputated. So let's roll that film, and then we're going to come back and have a little chat about that.
Great.
His foot's probably so dysfunctional at this point. That,
it's useless. And what I need to do is, though, I want to schedule some time if we can. To just come in and do it. So I don't know what the procedure is for that.
I'm not that backed up that if you give me a couple of weeks' notice on when you want to do it, though.
He's ready to do it. I'm thinking the end of October, like the last week of October.
Well, as they say, a picture is worth 1,000 words. Joe, take us back to that conversation. That was the second amputation.
Yeah.
Was the conversation with the first amputation different from the second? Because it sounded to me a little bit like in the second one, you're like, let's go, it's done, let's get this out. You were driving more of the conversation and the will to have it done. What was the first one like?
Well, the first one was similar. I had gone through a long period of time with constant infections in the foot, and it would also tend to retain fluids, so it would get nice and big. And I had been living with that for a while, but I never, it never occurred to me that I was going to have an amputation. At one point, though, what happens is when you retain that much liquids in the foot and you're going through chronic infection, the bones get very mushy. And so at a certain point, I wasn't even able to stand on the ankle. It would literally, it would crunch. So at that point, the doctors told me it had to come off, and I was a little more freaked out about it the first time. But having lived through it the second time, not that it made it easier, but it made me able to cope with it better.
So you go in the hospital for the first amputation, and take us, what was that experience like?
It scares the daylights out of you. I mean, it's not an easy thing to go through, obviously, but the staff was wonderful. This was done at Montefiore Hospital, and between Montefiore and Einstein, and the staff was just wonderful, and they just take you through it. And they make you not as afraid to go through it. But it's a very, very difficult thing mentally, not only physically to go through, because there's so much rehabilitation and so much stuff to get you back standing and doing things. But mentally, it's very tiring. There are days you just can't stop thinking about it. Mm-hmm. But you get through it. You do. People are amazing, and you wind up getting through it. And like my doc said, he would have little problems, or he would have problems, and I would watch him because, like, at one time his back got thrown out, and he didn't do anything. He just dealt with it and just did what he had to do. He had to get from point A to point B, and he just did it. He didn't care how he did it, and that was an inspiration to me, and that made me say that I can do this. I can get through this. And sure enough, I was back up and walking again.
Mm-hmm. And getting back up and walking, how soon after your amputations are you fitted with a prosthetic?
The first time it took a little while. The first amputation, it was about 6 months. Mm-hmm. And the thing is, you're moving, the technicians call it a moving target because your limb is always changing. So once you get your prosthetic, like in this case with my new prosthetic, within 6 months, you need another prosthetic because your limb is constantly shrinking, it's changing shape, and they mold these harnesses that as you saw in the video, they mold these things to customize for your limb. And what happens is that if they start shrinking and if they start altering their shape and stuff, they're either very painful or they get very loose and you can't really walk on them too well. So yeah, it's basically that process that makes it a long time in the recovery. And not just mentally, again, physically. But once you do it, you set those goals for yourself. You say, I'm going to do this. I'm going to get to it. I don't care what it's going to take. And even now, I mean, I'm still walking with a crutch, but my goal is within 6 months to, once they give me the new socket, is to start walking without anything. Just be back on my feet and be normal again, or as normal as I can be.
So when they're getting ready to amputate, do they say, Joe, we can take it here, or we can take it here? Or is there...
There's two basic amputations. There's an above the knee, which is very, very difficult to live with, and below the knee. I was lucky both times to have below the knee amputations, which is great, which means that the infections didn't spread up into your leg or into your other parts of your body. It's amazing. Once I got out of the surgery, it was like everything the infections caused in my body, the sick feeling, everything. I literally was in recovery. I opened my eyes and I felt 1,000 times better. So yeah, it's really it is a lifestyle. In my case, it wasn't a choice; it had to come off. But if you're feeling sick and eventually they're telling you it's going to have to come off, it's better to do it earlier than later. It really is, because it'll make such a difference in your life.
Yeah.
And as you said, when you're getting your prosthetic fit and your limb is constantly changing and resizing, is it very difficult to learn how to walk again as that process is happening?
Because I had it once with the other foot, it made this process easier. Like the first foot, like I said, took 6 months to get the socket and things. I had the amputation in October. In November, I was already getting fitted for a leg. I was back to work, and by I think it was the end of December, I had the leg, the new leg already. So the process was much more time condensed for the second one.
Yeah.
And not that I'm recommending to do it, have amputations and do it, at different times, but it did make it easier having it done at separate times as opposed to all at the same time. And even the doctors say that. They say you're going to have a much more easier time to the rehabilitation, now than you did the first time.
And were you working with a physical therapist both times?
Yeah. Montefiore has an amazing clinic called the Lubin Clinic. And those guys are just, they don't let you get away with anything. It's like boot camp. You're in there, you're in there for rehab. You're up at 6 o'clock in the morning. You're eating breakfast. You're doing your occupational therapy, your physical therapy. You rest, then you go back for more physical therapy, and then you start crying. They don't care. They just have you doing something else. They were wonderful, wonderful people.
So, after both amputations, did you go through any post-traumatic stress disorder syndromes? I mean, you just lost both your legs and.
Me, I never look back. I'm one of those people who, like I said earlier, I tend to be able to deal with things. I've been to support groups where some people are not as easily able to deal with it, and it's really tough. And I'm not saying you don't think about it, but I keep myself so busy between work and my personal life and whatever else that I don't have time to reflect on, why did this happen to me and what am I going to do. I have life to live. I have so much to do, and I'm going to do it. And if you just keep thinking back and you keep sort of feeling sorry for yourself, or you just, don't know how to deal with it, there's lots of places you can get help. But the secret to it, to surviving it, is to always maintaining a great attitude, setting goals, and accomplishing those goals. And you'll see how quickly it goes.
Now, we live in a city where we rely heavily on public transportation. How kind was the city, or not, to somebody who has just lost both of their legs? Did you find getting around was easy and accommodating, or was it somewhat of a challenge?
I'm not a public transportation person, so it's not a good question for me because my job it pays me very well, so I take car services everywhere. I haven't been in the public transportation system for about 15 or 20 years, so I can't even tell you what it looks like down there anymore. But that's a really hard question for me to answer because I really don't experience it on an ongoing basis.
I'm going to send you my resume. So if you were to look in the camera and deliver one message to our viewers and audience who are watching this, and we have a very large community of diabetics, what is it that you would say?
If I look in the camera right now and talk to you guys, what I would say is you don't know better. Okay? It's a disease that you don't feel. You always think you're fine, and you're not. It's so important to get yourself checked. If it runs in your family, if you feel very tired all the time, there are definite symptoms that you can sort of figure out if you have this disease or it's something you're going to develop. Don't think you know better. Okay, get out there, get yourself checked. If you have diabetes, stay with the program. Unless you want to wind up one day in a clinic next to me adjusting your prosthetic, trust me, it's the thing to do. Listen to your doctors.
Well, Joe, thank you for coming in today.
My pleasure.
Really appreciate it. I've got some swag for you here.
Oh, look!
Nobody gets away without a Healthy 360 wristband.
I've been eyeing that watch.
They sell them on the corner, actually. They're very, very cheap. But thanks again. Well, that's our show for this week. I'd like to thank our guest, Joe Tavano, for joining us in the studio today. Thank you. I'd like to thank our viewership and members at home for tuning in. And remember, all of our episodes can be viewed video on demand at healthy0360.com. Healthy0360 can also be found on Facebook, Instagram, Twitter, and Pinterest. And please don't forget to use the hashtag #RealStories when posting. So on behalf of Cortland Long and everyone here at Healthy0360, we wish you a very pleasant afternoon, and we look forward to seeing you again next week.
The views and opinions expressed in this broadcast are those solely of the Healthy 360 hosts and our guests for this broadcast. These views and opinions do not in any way reflect the views and opinions of our sponsors, advertisers, or other organizations on Healthy 360, including our community members.